Okay, so moving on and looking at the mechanics of breathing during exercise, what we need to do during exercise is we need to try and get the air in and out of the lungs faster, and we also need to try and move greater volumes of air. So just relying on the external intercostals and the diaphragm isn't going to be enough. So what we do is we recruit what's called extra inspiratory muscles, and we recruit some extra expiratory muscles. Okay, so talk about the inspiratory muscles first. So if you've started exercising and you need to try and get more air into the lungs, you need to try and increase the size of that chest cavity that little bit quicker and with more force. You use two extra inspiratory muscles. They're the sternocleidomastoid, that's a mouthful, sternocleidomastoid, and your pectoralis minor. Now your sternocleidomastoid, part of it, sterno, meaning sternum, means that muscle's actually attached to your breastbone there. And then it's also attached here in your neck. And what that does is when you contract it, it pulls your breastbone up. So if you've ever seen somebody breathing in really, really heavily, really quickly, you might sort of see these bits here. Basically, as your sternocleidomastoid contracts, it's going to be pulling that sternum, that breastbone up and moving the whole rib cage up really, really quickly. Your pectoralis minor, which is located around here, your pectoral muscles, or it's part of your pectoral muscles, that helps to push the rib cage outwards. Okay, so it's basically helping the external intercostals and the diaphragm. They're still working just like they were at rest, but now they've got a helping hand from these more powerful muscles that, again, all they're trying to do is make that rib cage go upwards and outwards and try and reduce the air pressure inside it by making the chest cavity itself larger. Now, during expiration, you also use a couple of extra muscles. For that, you're going to be using the internal intercostal muscles. And you're going to be using the rectus abdominis. So your internal intercostals, a bit like your external intercostals, they're placed between your ribs. This time though, when the internal intercostals contract, they are all about squeezing the ribs down and together. Okay, so trying to reduce the size of your chest cavity. Your rectus abdominis is here, what you might refer to as like your six pack. When that contracts, that's basically trying to help to push your diaphragm back up into position really, really quickly. So you basically using these tummy muscles, your rectus abdominis, as they contract, they're reducing the size of the chest cavity by pushing the diaphragm up from underneath. Okay, so just to recap, external intercostals and diaphragm are still working during exercise just as they were at rest. So they'll contract when you are inspiring and they'll relax when you are expiring. But they're going to be doing this with the help of the inspiratory muscles. That's the sternocleidomastoid located on your sternum, that's pulling your rib cage up, and your pectoralis minor, which is helping to bring the rib cage up outwards. So upwards and outwards action when you're inspiring. And then you've got the expiratory muscles working when you want to expire, try and force the air out of your lungs. You've got the internal intercostals bringing the ribs down and together, and you've got your rectus abdominis trying to contracting from your tummy, pushing that diaphragm back up into position to force the air out of the lungs. So when they contract, you are forcing air out of your lungs, rather than during rest just letting these muscles here, the external intercostal and diaphragm, relax. That's not good enough. During exercise it needs to be faster. That's why I use these expiratory muscles to try and force the air out of the lungs.